This is an ultrasound study of young female primary gravida with a history of bleeding by vagina and pain in the pelvic region. They have a history of amenorrhea for the last 2 months, positive pregnancy test, beta hCG levels are declining, and what we see, I'm trying to show you in this segment is this is the uterus, the cervical region, and this is the internal os. Having aligned it with vagina, you can see that this is the internal os, cervix, and this is the vagina. The cervical length is 5.1 centimeter in longitudinal section. Now as I move the probe superiorly anteriorly, I see that there is a fibroid seen at the upper segment of the anterior myometrium, anterior wall, measuring 3.9 into 4.6 centimeters. This is the fibroid. A hump you can see. This is the urinary bladder. This is the hump seen. This is the cervical anterior segment, cervical posterior segment, posterior lip or anterior lip. You can see small amount of fluid over here, and then as we move upwards, you see a hypoechoic area, well demarcated, and this is the endometrial canal where it is encroaching upon. This is the fundal region. This is the posterior myometrium in this longitudinal section. So up to this point of study, we have seen that there is a fibroid approximately measuring 4.6, 3.9 centimeter with a bulge, and it is subserosal fibroid. And then as I move upwards, she gives the history of 2 months amenorrhea with spotting now for the last 4-5 days. So here you will see a cystic area which is best seen in transverse section. Tiny cystic area in the this is the transverse section. This is a small tiny cystic area. This one measuring approximately 7.9 mm. There is trophoblastic reaction seen around it, and this small tiny cystic area is consistent with a gestational sac. Incomplete abortion. You will see it in longitudinal section as well as in transverse section both. Let me show you in another view. This is a small tiny cystic area with echogenic rim around. This cystic area is consistent with a gestational sac, deformed gestational sac, and patient with history of bleeding and pain for the last 4 days. This is consistent with incomplete abortion at this present day of ultrasound. Now this is a case of threatened abortion with fibroid of the uterus. Is there any other fibroid? Yes, this one. Now if you see, this is another fibroid. It is in subserosal location, anterior wall, with the largest one seen in the anterior wall, relating to the anterior wall. This is the largest one. This is the sac. See, when I give a sweep to the probe, it does not change its shape. It retains its shape, and this is the sac. This is the sac. So this is a case of uterine fibroid with threatened abortion. With the incomplete abortion. Thank you very much.